A couple of weeks ago, I posted a video about the stomach acid challenge test to determine whether someone may have low stomach acid or not. And someone asked a question based on that video. And it was a really good question, which is if someone's taking a proton pump inhibitor or PPI medication, can you still do that test? So it's a great question. As per usual, nothing I say should be construed as medical advice. This is for informational purposes only, and please talk to your personal healthcare provider before making any medical decisions for yourself. But for informational purposes, really interesting topic. This is something that I've thought about over the course of time because I've encountered this scenario with patients on a number of occasions, and somewhat ironically, in my clinical experience, a lot of the patients that I've seen who wind up benefiting from proton pump inhibitor medications, many of them actually wind up in hindsight having low stomach acid issues that are driving their need for the proton pump inhibitor. And there's plausible explanations as to why that's the case. I'll leave that for a future video. If anyone's interested, feel free to ask and I can comment on that. But getting to the question at hand of can someone do this test? So bearing in mind that the way the test works is that the patient takes a certain dose of supplemental stomach acid known as betaine hydrochloride. They take that with a meal, and then depending on the reaction that they have, it will give the clinician insight into whether they might have low stomach acid or adequate stomach acid or maybe high stomach acid. So when a person takes a proton pump inhibitor, that the drug really lives up to its name. It's inhibiting this proton pump. It's preventing the excretion of hydrogen molecules into the stomach lining or into the lumen of the stomach, the body opening of the stomach, if you will, the insides of the stomach, shall we say, and that thereby inhibits the acidity from building up. So proton pump inhibitors are not antacids. They're not acid neutralizers. They inhibit the stomach's ability to make acid in the first place. And so therefore, in my opinion and with my patients, I absolutely do stomach acid challenges when patients are working with proton pump inhibitors, because what is essentially happening is when the patient takes that medication, their stomach acid production goes way down, and then we can see, well, when they take the stomach acid supplement, does that manage to induce the type of reaction that we're looking for to determine if there is a stomach acid deficiency or not. If we see that, and again, I just have to be a little careful with my language because I don't want to be specifically outlining what the testing entails and involves, because I, again, don't want it to be construed as any type of medical advice, but ultimately we can glean that information from the patient's reaction. And in many cases, I'll have my patients who are on proton pump inhibitors when they're helping. They continue to take their proton pump inhibitor, usually just once a day, sometimes twice a day, but usually just first thing in the morning. And then they'll take their stomach acid with meals. And so in that case, what we're getting essentially is the best of both worlds. We have more acid at mealtime so they can digest their food better, have less gas and bloating, maybe less nausea, better appetite, like whatever it is that we're treating with it. But then in between meals, the stomach acid level is kept nice and low so the gastritis can heal or the ulcer can repair, or whatever it is, maybe they have Barrett's esophagus where we need to keep the acid levels down as much as possible, or else it's increasing the risk of esophageal cancer or what have you. But we can kind of have our cake and eat it too, so to speak, and use both at the same time. So I've managed that in many cases, and in a lot of cases, unless it's something more like a Barrett's esophagus where we want to keep the PPI in there for good measure long term. In many cases, the patient is able to wean off of, at the very least, reduce their dose, and in many cases, wean off of their PPI so that they don't need it anymore, because we're actually correcting the root cause factors that led them to needing it in the first place. So thank you for the question. That's a very good question, and I hope this answers your question. If there's any questions about this topic or anything else, please post in the comment section below, and I will leave it there for now.